Welcome. My name is Muhammad Ahmed, and today I'll be presenting the effects of transcranial tract current stimulation, often called as TDCS, in context of neuropsychiatric disorder schizophrenia. Alright, let's start it with schizophrenia. Schizophrenia is a severe mental disorder that affects around 1% of people worldwide. It typically appears in late adolescence or early adulthood, as it isn't just about hearing voices. People with schizophrenia often experience positive symptoms like hallucinations and delusions, meaning sensations or beliefs that aren't based in reality. And they may also have negative symptoms such as flat emotional expression, low motivation, or social withdrawal. Finally, many suffer with cognitive symptoms, trouble with memory, attention, or decision making. This can disrupt not just the person's own life but also their families and wider communities. Treating all these symptom groups at once has proven to be a huge challenge. Despite medication, many patients don't get full relief, which is why exploring new treatments is so important. Now let's move deeper into the brain. What is the physiological effects of schizophrenia? Schizophrenia is associated with imbalances in brain chemicals, which is also called neurotransmitter dysfunction, especially dopamine and glutamate. Dopamine overactivity can fuel positive symptoms like hallucination, while glutamate problems are linked to cognitive and negative symptoms. On a structural level, the prefrontal cortex, a region key to planning and flexibility, often shows reduced activity and volume. So, what causes these disruptions? It is complex genetic risk factors, early development, environmental triggers all play roles. At a neuron level, schizophrenia appears to involve abnormal connections and brain signaling, especially a mix up in excitation and inhibition. Imagine a team where some players always shout and others are too quiet. So, these network issues help explain why standard medication can only help certain symptoms, not all. Other changes like unusual loss of gray matters can also be seen. Altogether, these changes affect how people think, feel, and interact with the world, and making daily life very complicated for those affected. Now let's introduce TDCS. This is a non-invasive brain simulation method, which means it can change brain activity without surgery. The main parts are a battery-powered current simulator, two electrodes, anodal and cathodal, connecting wires, and often a headband or a cap to hold the electrodes in place. Electrodes are usually sponges or gel pads that touch the skin soaked in a conductive fluid to ensure good electrical contact and comfort. A stimulator unit precisely controls both the strength and duration of the current precisely between zero point 0.5 and 2 milliamperes for up to 20-30 minutes per session. Anodal stimulation increases excitability, making neurons more active. Cathodal stimulation decreases excitability, making them less likely to fire. TDS works by delivering a weak and safe electrical current to a scalp via small sponges or electrodes. Depending on the way the electrodes are positioned, TDS can either increase or decrease the likelihood that neurons in a specific areas will fire. It is a safe, well tolerated, and cost effective and portable, making it ideal for research and potential future therapies. Now let's discuss some physiological effects of TDCS. TDCS does more than just zap the brain. The current tweaks the natural change across the neuron membrane, making it easier or harder for neurons to fire. With the right settings, TDS can boost neuroplasticity, the brain's ability to adapt and form new connections. It also indirectly affects key neurotransmitter systems, including dopamine and glutamate, and may help restore more normal rhythms and network activity. Recent advances in computational modeling have even let us how TDS changes current flow within the brain. So, why does this matter? When used correctly, TDS may help normalize abnormal brain activity linked to disorders like schizophrenia. Its effects can linger beyond stimulation because it helps train the brain's problem areas. It is also an exciting tool for researching the root causes of symptoms since it lets us reversibly tune brain regions and ask what changes when a brain is temporarily made more or less excitable. Now let's begin the literature review with the first study of special span test scores after TDCS by Howe at 2024. Let's begin with the clinical trial designed to test how TDCS affects working memory in people with schizophrenia. Researchers divided participants into three groups. Two active treatment groups received TDCS over either the dorsolateral prefrontal cortex or the posterior parietal cortex, while a third group received sham stimulation, which mimicked the process but didn't actually apply current. The treatment lasted for 10 sessions over 5 days, with each session lasting about 20 minutes, so it was both rapid and intensive. To measure changes, everyone took a special span working memory test at the start, after 1 week, and after 2 weeks. The results shows that those receiving stimulation over the parietal cortex had significantly improved working memory scores at week 1, close to that what is typically in healthy controls. The other groups showed little change by comparison. In other words, careful targeting of TDCS can lead to a measurable gains in thinking skills for some patients, though not for all. The second study I want to discuss is a randomized controlled trial for cognitive symptoms by BOSS at 2024. Our second example examines a randomized controlled trial, often called the gold standard in medical research. Here, people with schizophrenia were randomly assigned to receive either active TDCS or sham version. In addition to their regular treatment, the stimulation targeted cognition related brain areas, mainly the left prefrontal cortex, and was delivered across multiple sessions. To track progress, researchers assessed cognition using tasks like the paced auditory serial audition task. They also rated symptom severity with standardized tools such as Clinical Global Impression Scale and the PANSS scale. Results found that patients in the active TDCS group improved their cognitive scores and showed reduced disease severity for specific measures. Although some symptom scales didn't show significant change, this study highlighted how TDCS, when added to a standard care, can provide a valuable boost in the mental performance for certain individuals. The third study is Neurophysiology EEG TDCS mechanism by Agarwal at 2023. The third study moves to the neurophysiological level. Here, healthy volunteers underwent single or multiple TDCS sessions aimed at dorsolateral prefrontal cortex, while scientists tracked changes with EEG brainwave recordings and working memory tests. The sessions were brief, about 20 minutes each, and researchers monitored for any adverse effects. In this experiment, a nodal TDCS increased both theta and alpha oscillations in the brain, which correlated with faster responses and improved working memory performance. Cathodal TDCS did the opposite, reducing these beneficial brain waves. Importantly, the procedure was very well tolerated with minor temporary discomfort only. This mechanism focused study shows that TDCS can directly enhance brainwave patterns associated with cognitive functioning, supporting its therapeutic potential while confirming safety. Now, it's the summary of all the previous three studies. TDCS has proven effective in reducing key symptoms of schizophrenia, including auditory hallucinations, negative symptoms such as social withdrawal, and some cognitive deficits. It works by altering the resting membrane potentials of neurons, with either increase or decrease their firing rates depending on the polarity of stimulation. This modulation improves cognitive functions like working memory, attention, and executive control by targeting the prefrontal and parietal brain regions. Additionally, TDCS help normalize abnormal brain rhythms in the theta and alpha bands, which are associated with working memory and attention deficits in schizophrenia. It also strengthens communication between the brain regions that are typically disrupted in the disorder, supporting overall symptom improvement. Importantly, TDCS is a generally well tolerated with only mild side effects such as scalp tingling or discomfort, making it a safe and promising neuromodulation approach for schizophrenia treatment. Now, what are the gaps in existing knowledge? First, there is no consensus on the best stimulation protocol. Factors like electrode placement, current intensity, and number of sessions can vary widely between studies, making it hard to compare results directly. Additionally, individual differences between patients, such as genetics, severity of illness, and unique brain biology, means that some people respond well to TDS while others see little less benefit. Most research so far has also focused on short term effects with less attention paid to long term safeties or real world impact. Now, the directions for future research. We have to conduct large multi-center randomized controlled trials with standardized TDCS parameters. We have to investigate biomarkers that predict treatment response and monitor neural changes during and after TDCS. We have to develop personalized stimulation protocols based on neural profile. We have to study maintenance strategies and combination therapies, and we also have to focus on translating mechanistic insights to functional improvements in daily life and global psychological health. And that's it, and there's the reference list.